The World Health Organization in the year 2020 reported 604,000 cases of cervical cancer. That's globally, the entire world. And out of that 604,000, 342,000 deaths were reported. Hello and welcome back to my YouTube channel. My name is Query, and on this channel I talk about all things reproductive health, and I talk about nursing education, lifestyle, and everything in between. If you know you are seeing my face for the first time, thank you very much for clicking and watching this video. Please subscribe to my channel, like, share to your friends and family for them to be aware of their reproductive health. And also thank you very much for my returning subscribers. Now this is January 2023 and this month is cervical cancer awareness month. Yes, it's done every year. Now the reason why it's important for us to be aware of cervical cancer, I am going to discuss these reasons in this video. Now, what is cancer to begin with? Cancer, as defined by the National Cancer Institute, is abnormal growth of cells in different organs of the body, and abnormal cells that starts growing at a particular part of the body, particular organ of the body, are capable of spreading to other parts of the body, and it spreads there to cause issues because it will start competing with that organ for nutrients, for blood, and all that things that are needed for that organ to survive. And sometimes it overpowers the organ and then there will be failure. That's why people who have lung cancer might have lung failure, people who have kidney cancer might have kidney failure. So cervical cancer, this is cancer that happens at the cervix. Yes, and the World Health Organization in the year 2020 reported 604,000 cases of cervical cancer. That's globally, the entire world. And out of that 604,000, 342,000 deaths were reported. It is so sad. It is more than half. If you are a good mathematician, you do the maths, you will see that the number of deaths is more than half of the cases that are actually reported. But there's good news. Cervical cancer can be prevented. Yes. So who are at risk of cervical cancer? Number one is women with cervix. Yes, because the cancer occurs at that cervix. If you go back to the video that I did for you and your reproductive organs, for the female reproductive system, you see that the cervix is 1 centimeter long and it's between the uterus, which is the womb, and the vagina of the female. And the cervix is the organ that dilates, that opens up during labor. So that's number one risk factor. Number two is smoking. If you still go back to my video, I've done a video on the things that affect your reproductive health. You can check that out and you see that smoking is part of it. So number three is early sexual intercourse. So for people who had sex in a very early age, that's before the age of 18, they are at risk because of the way the virus that causes cervical cancer is transmitted. It is transmitted sexually, either by oral sex, anal sex, or vaginal sex. So another risk factor is weakened immune system. This is because of the causative organism. It's a virus that actually causes cervical cancer. So if an individual's immune system, a woman's immune system is low, for example, women with HIV, it will be difficult to fight. They are at risk of getting cervical cancer. So there are two other reasons, that there are two other risk factors, but those risk factors, the reasons is not well understood. So researchers are still on it. They are still trying to find why they are still trying to find the reasons for it, but I'm going to mention it anyway so you be aware. So those are the two reasons are use of contraceptive pills and having too many pregnancies. Okay, so the cause of cervical cancer is the human papilloma virus. This is also known as HPV. Human papilloma virus has different types. The virus has different strains, and the type that is implicated for cervical cancer is the type 16 and the type 18. And it usually starts, and what it does when it affects somebody, it starts at the transformation zone of the cervix. So a little bit of anatomy. The cervix has ectocervix and endocervix. Ecto is outside, endo is inside. But the area where the ecto and the endocervix meet is called the transformation zone, and that's where the cancer actually starts from. So for many people, if they are infected with the human papilloma virus, their body immune system fights the virus and then it's gone. But for other people, especially people with weak immune system, it doesn't go away, and then sometimes there may be persistent reoccurrence of the infection. And so if it's like that, the woman will get cervical cancer. So that's the cause of cervical cancer. Now let's talk about the signs and symptoms of cervical cancer. Now the first sign is no sign at all, which is known as asymptomatic. So the woman feels nothing. It's as if everything is okay, and that's why screening is very important, because you can't see your cervix with your own two eyes because of the anatomical position, so you won't know if there are abnormal cells over there. Yes, that's first sign. Now there are other signs that usually occurs when the cancer has passed the early stage. And what are those signs? Painful sexual intercourse, pelvic pain, bleeding after sex, excessive vaginal bleeding, excessive vaginal discharge that may be mixed with blood, even bleeding after menopause, bleeding between periods. Those are signs of cervical cancer. Mind you, these signs are also signs of other gynecological conditions. Yes, and it is important to be aware of cervical cancer because it's the fourth most common gynecological disease that affects women. And the human papilloma virus is gotten sexually. It means both male and female have it. So this awareness is important for both genders. What is the prevention for cervical cancer? Is screening and vaccination. So the screening done is pap smear. This simply means a smear is taken from the transformation zone of the cervix and then tested to detect cancer cells, to detect abnormal cells. And once it's detected early, it can be treated. That's for the screening. Another way to prevent it is by vaccination. Yes, vaccination against human papilloma virus. Once an individual is vaccinated against it, then he or she doesn't get it. So this vaccination can be given to children from age 9 to 15, and then adults, and then for adults is till age 45. There are 2 doses for children that are not sexually active, and then for adults that are sexually active is 3 doses. So you can go to the hospital and actually ask your gynecologist, ask your nurse about this vaccine. It is very, very important. Now for the treatment, is the way cancer is treated normally is the same treatment that is done for cervical cancer. Surgery is done, especially if it's early, to remove those abnormal cells. Chemotherapy, radiotherapy, these things can be done to remove it. So it is important you tell a friend about cervical cancer so they can prevent it. Thank you very, very much for watching this video. Please subscribe to my YouTube channel, like this video, comment. If you have any question, leave it in comments. I am more than happy to answer you. Thank you very much.